One of them is just a try-in of a denture, double arch denture like this, where the doctor would do a wash, or maybe not, and maybe did some occlusal adjustment, and we're going to scan that, upper lower. In this scan, we're going to take 2 try-ins. You know, with our ROE Dental Lab system, we can send you prototypes that we know are going to fit. They're made from your master cast, but if they're not, then you can always do a wash in them. But our idea here is you can maybe do a little bit of equilibration on the occlusion, verify the fit, the aesthetics with the patient, and then really, if all you made was some occlusal adjustment, all you have to do is scan the occlusion and send it back to us. Scan the occlusion, scan the bite. We'll update our digital files and make you some final dentures. It's pretty slick. But let's just say you did a wash impression, wash, bite, registration, and everything. Let's scan that, because then you can digitally send it to us. All right, here we go. So let's talk our way through this scan. And what we always do with dentures is we always start with the intaglio. We always identify the full arch, as opposed to just, you know, doing a pattern back and forth on the palate and the vestibule and the ridges. We want to identify the full range of the denture. So that's what we did there. You can see this thing just really scans nice and fast. Very impressive. Let's get inside here, like that, beyond the borders. All right, behind the flange. And then what we're going to do is kind of like what we always do, which is we're going to start adding some of the facial in. Oh, let me catch up here. I'm going to add the facial while we're scanning the border, because that way it has some of the old and it has some of the new. All right, just like that. Don't get ahead of yourself. Don't start scanning the teeth until we've got this full range scanned here like that. And I think I could probably go a little faster. I don't want to, because I don't need to, and I don't want to have to make a mistake and start over, but kind of pacing myself here. Okay, there's that. And then we'll just kind of roll over to the occlusion. And then this is just normal scanning here. Let's bring it around. You can scan some of the lingual and, oops, getting a little shaky here. My fault. There we go. Come back around and get the teeth really nice. Get the linguals. Perfect, like that. And then, as you know from all of our other denture videos, we don't need to scan the palate. There's just no point in scanning it, because we need the intaglio to get the thickness. We've already got the border, and I am going to go across the border because I'm pretty sure this scanner can do it. Actually, I'm going to do it from the intaglio. And I just want to make sure I got this post-palatal border seal just like that. Okay, that's the lower. And then that's the upper. Got them backwards here, but that's okay. Save current scan, go to the next one. It's going to render here for a second. And then same thing, just follow the rule. The rule is scan the intaglio first. I'm going to go a little faster. It's a lower, not as much material here to capture. Okay, nice. Just follow the plan, which is to add some teeth, labial buccal area with the flange, and then come around this way. Okay. I'm going to change my fingers to a different position. There we go. It's really impressive how it'll actually pick up on a border where there's not a whole lot of anatomy, and start from there. Okay, all right, now I got to follow my rules here. I just started getting the distal extension, and we don't want to do that. We want to stay within our rules, which is capture the labial, just like so. Let's come back to the occlusal. Wow, this thing scans nicely. Okay, very good. Now we could, if we got the intaglio really good, we could just stop right there, because you don't really need the lingual. The the thickness of a denture is going to be to a standard, but that's okay. We're going to scan it anyway just to prove that we can, even though that's the shiny part of the denture. There we go. See a little bit of my finger got caught in there. That's okay, it'll erase it. See that? Which actually does a really nice job of erasing scans that you don't want. I'm not quite sure why it's overdoing, going over that distal part there. Okay, there's your denture, 360, and now we're going to scan the bite. Save the scan. Okay, push play. And then this is, this is where you want to decide if you're having any trouble at all capturing the bite on the patient, you might want to put both dentures back in the mouth and take the bite. Otherwise, if you can hand hold them, then just do that and scan a whole bunch of the teeth. You don't want to wait until it picks up the upper and the lower and then be done with it. Scan the full facial, because if something happens where we're not capturing the bite, or it's not putting the upper and lower together, we can manually put it together with a beautiful bite like this. All right, there's our bite. That's a fast scanner. There you have it.